Hello there, my name's Heidi. I've been a nurse for 9 years. This month I wanted to produce something from all the learning that I'm doing, kind of to shape what I'm learning into something that I can give to a patient, like preventative information, stuff that you can do now to help you with this, that, and the other. I'm just going to do a body system per month. The skin, the integumentary system, which is skin, hair, nails. I do want to have a disclaimer statement that this is not prescriptive medical advice. I am not your medical provider. These are just kind of preventative measures. A lot of these things I found by looking at evidence-based resources and things like that. With all that being said, if you have any question about these things, you need to bring that to your healthcare provider. I'm not going to be liable for any decisions you make based on the information I present to you here. I'm not trying to substitute as a personal, professional health provider in your life, just bringing some advice. I'm not trying to diagnose or prescribe treatment for any kind of ailment. I'm just bringing knowledge. Before you start any kind of health regimen, you should consult with your doctor. To begin, let's do a mindfulness practice. This is something that I've learned about that is very helpful to bring us into the present moment. So it's pretty simple. The point is just to kind of line your body up with what your mind is doing, So we'll just take some deep breaths in our nose. Hold it for like 2 or 3 seconds and then out your mouth slowly for like 2 or 3 seconds. We'll just do like 2 more of those. Very good. And just kind of like be aware of your surroundings. Is it super loud where you are? Is it a distracting kind of situation? Or could you tune a thing or two out so you could focus on what we're talking about while we're in this video? Good. Very nice. Nothing like a good deep breath to really just wake it up your mind to receive some information. Let's begin with the integumentary system. Hair, skin, and nails, and glands all up in the skin. This integumentary system is the largest organ of the whole body. It does so much for us. It's the largest organ. It covers your entire body, and it actually accounts for 20% of your body weight. The primary function of the skin is to protect your body from the environment. It's like a barrier, very, very literally and clearly, it's a barrier against all kind of outside forces, microorganisms like bacteria and viruses, UV radiation like from the sun, loss of body fluid, mechanical force like, mechanical forces. It helps regulate your body temperature, and there's even has immune properties. So your skin is working all the time. It's working hard for you. So let's learn how to take care of it. What I want to talk about is looking at your skin, doing a regular survey of your skin, looking for any new growths or like wounds or rashes or any changes in the quality of your skin. If you regularly are checking your skin, you'll notice if something new crops up. One thing about skin is because it's so large, there's a lot of real estate for like lesions or rashes. There's lots of folds and like places where it's moist and warm, where bacteria likes to live. So bathing, this is 101 really, but bathing regularly, like daily, especially those dark, damp areas, is really important to decrease like the colonization of bacteria and grody things that can cause you to be ill or have wounds and all kinds of stuff like that. So taking a bath, that's number 1. Surveying your skin for like cancerous lesions. There's a acronym or mnemonic. It's ABCDE, particularly for identifying cancerous lesions like melanomas. So, if everyone's skin is different, obviously, more or less melanin, hair distribution, moles, stuff like that. But if you notice new skin formations, lesions really, you want to check them and watch them, monitor them while you're regularly monitoring your skin for any kind of changes. So we'll go through the A, B, C, D, E. A is for asymmetry. Is it unequal in, like, from side to side? If you cut it down the middle, are the sides equal? Because generally they grow in a circular kind of fashion, like moles and stuff. Is it asymmetrical? B is for border. Are the borders blurred or irregular? Generally with benign skin lesions, they are pretty marcated, good demarcated borders, but so is the border irregular or blurry? What about the C for color? Is it pretty uniform in color, or are there like multiple shades throughout it? Generally moles are like brown and it's a distributed color across it, but are there different colors? And have you noticed? D is diameter. Is it any larger than a 1/4 inch or a pencil eraser? Generally, they're, moles are smallish, but if it gets to be about the size of a pencil eraser, that's starting to be pretty large and can be an indicator that it is a skin cancer. And E, evolving. So all these things you're watching, A, B, C, D, and then E, is it changing over time? Is it growing? Is it changing in color? Is it becoming more and more asymmetrical? So those are things that you can watch for whenever you're monitoring your skin. If you find a lesion or a skin formation that's new or looking weird to you, go ahead and keep your eye on it and monitor it daily, weekly, weekly, monthly, maybe. If you're noticing that it's changing, you need to go have it checked. Skin cancer can be very manageable if that is indeed what the growth is. So, the skin, it's large, it's in charge, and you should be looking after your skin and taking care of it so it stays intact to protect you from these external everything, the wind, the rain, the harsh, dry times. So I talked to my niece and one of her school friends, and I was like, what kind of things do people want to know about their hair, skin, and nails? What do the people want to know? And they said, my skin's dry. What do we do about this? Okay, so according to the Academy of Dermatology, they had some pointers about how to combat dry skin. It develops when your natural oils are stripped away. Over excessive washing, like if you work in an industry where you're washing your hands a lot, in the food industry, healthcare industry, pretty much everywhere you should be washing your hands, but sometimes whenever you're working with the public, you end up washing your hands a lot. All that kind of stuff strips your skin of its natural oils, and then your skin will lose water too quickly, and it dries out the surface of your skin. There are other factors. People with darker skin, black or brown skin, or fairer skin tend to lose moisture more easily. So it's more like the medium tone, kind of Mediterranean type skin stays pretty moisturized. Cold weather, the air is less moist when it's cold. UV exposure, like to the sun, smoking dries your skin out, and some medications and medical conditions can leave your skin dry. Treatment is generally aimed at relieving the symptoms you have. Could include the dryness, and itching sometimes comes with dryness of skin. Treatment focuses on restoring what's missing from your skin to help it heal, and then preventing further problems. So how do we prevent moisture? Moisture is key. I guess that seems obvious, but use moisturizer, okay? Put skin lotion on. And there's difference between lotion, cream, ointment. The lotion is more watery, cream is less watery, and it'll has more emollient effect. It'll squish into your skin and really moisturize better. And an ointment is like really serious, heavy duty stuff like petroleum jelly that can really create a nice barrier. Put some of that petroleum jelly on your hands and put your hands into some gloves overnight. Really, really moisturize. Really locks in the moisture. It's important to moisturize within 5 minutes of getting out of the shower, because that hot water on your skin after washing off all your oils, and your body water just evaporates away. So if you can put that lotion on right away on your damp skin, that's it, you guys. That will help a lot. Try and use fragrance-free or alcohol-free products, especially if you have like stinging of your hands and skin, because those ingredients can really, get into the cracks or crevices whenever you have cracked, dry hands and skin, and it can sting and burn you. You could use an air humidifier to put more moisture in the air, and protect your skin when you're outside, especially in the cold weather, in the extreme weather, super cold or super hot. You want to protect your skin, wear layers, wear gloves while you're doing wet things like washing the dishes or washing the dog or whatever, washing the car. When your hands are going to be wet, wear some protective gloves. And we can get into skincare now. You want to use gentle cleanser when you're washing. And I'm focusing on the face because the body pretty much follows the same rules, but the skin on the body is more, it's thicker. There's more keratin in in the layers, or in the outer layer of the skin, so it's more hardy. But the skin on your face is thinner. You have more nerve endings and things on your face, and we're all it's the money maker, so they say. You want to keep it looking nice and fresh. So anyway, cleansing the face. There's 3 steps, okay? They get it all. Everyone's crazy about skincare, but really it's 3 steps. Cleanse it, moisturize it, and protect it, okay? We do a cleanse, we do a moisturize, we do a protect, okay? So, washing the face is important to wash away dirt, makeup, impurities, helps prevent clogged pores and breakouts. Using a gentle cleanser, fragrance-free, alcohol-free, it's usually only necessary once, maybe twice a day. You don't want to do more than that because you'll start to dry your skin out with all these products we're using. Using too many products in general will irritate your face, your skin. So go in that order, cleanse it. If you are prescribed any kind of facial medications, do that next, and then you moisturize and protect it. And if you're doing makeup, you do it at the very end. When we're washing our face with our gentle cleanser, use your fingertips, okay? You don't have to use a washcloth. You don't have to use a scrubber, any kind of like abrasive scrubby device. They do have those little like nylon nubby things. Those can be okay. Those kind of simulate fingertips, but once you get, even a washcloth can be too abrasive, and it can pull your skin on your face, and it's too abrasive, and it can irritate your skin. Your fingertips are perfect. That's how God made you. He made these perfect little scrubbers to really get in there. Okay? So using your fingertips, wash your face with your gentle cleanser. Don't forget your neck and your décolletage, like your neck, chest area. This is all the face, all included, okay? So what you're washing, you're done. Then you rinse with lukewarm water. Ooh, just splash it on. You don't want to use hot water for those reasons we were talking about earlier, how it will kind of cause your body water to evaporate out pretty quickly. So lukewarm. You could use cold because there's lots of good things about using cold things on your face to help decrease inflammation and puffiness and whatnot. So you could use cold water, but that can be kind of shocking too. So there you go. You're rinsing, and then you want to pat your skin dry. Don't rub it because that's too abrasive. You just want to pat it dry with a clean towel. And at this point, you'll apply your moisturizer. And you can even leave your skin a little damp to trap the moisture. That's the whole idea. That's the whole point with the moisturizer, is to trap the moisture in. So you can leave your face a little damp, apply your moisturizer. You could use a moisturizer combo with an SPF. They make these. So you don't even have to do 2 steps. You just do it all in one. You can do that first, in the morning time to protect your skin throughout the day. Recommend using mineral sunscreens like zinc oxide, titanium dioxide. These are generally less irritating and burning sensations to the skin, to the facial skin. And as far as the rest of the body, it's generally, like we were saying earlier, it's generally the same concept. You could use a washcloth and exfoliating glove kind of stuff on your body, though, to exfoliate, because it's a little more hardy. It's a little than your facial skin, and there's more keratin in your skin layer, especially that outer layer. So using a little bit of mechanical exfoliation is good for your body skin, okay? But not the face décolletage areas, okay? So, wrinkles. Let's talk about it, okay? It's a natural part of the aging process. It is natural to have wrinkles on your skin. You know, Photoshop, airbrush, how they're doing the things. It's not natural. It's kind of weird, honestly. But what causes it? As we age, there's a decrease in the production of the building blocks of the skin, such as collagen, elastin, and hyaluronic acid. And with a decreased amount of these building blocks, the skin looks thinner, it becomes drier and less elastic over time, which leads to the appearance of fine wrinkles, lines, and creases, and it's just easier to see. See my puppy? That's Levi. He's a good boy. He's taking a nap. Okay, so aside from aging, there are other factors that can contribute, including genetics, environmental exposure, like air pollutants, and smoking is a huge one, UV exposure, like to sunlight, skin tone and amount of melanin that you have contributes a lot to prevalent or tendency to have wrinkles. Prevention. Okay, guys, prevention's the name of the game. That's something that I live by and want to encourage in my patients, and that's kind of the whole point of this podcast. Prevention, okay? If you prevent something from happening, you don't have to work so hard to fix it. You know, you fix the problem before it even becomes one. So anyway, big deal. All the dermatology firms will stand behind this, that the most important prevention is sunscreen. We got to protect our skin from UV rays, okay? It's SPF 30 or greater daily, and reapply it if you're outside a lot that day. Reapplying, and you want to put it on all the skin that's not covered by clothing, okay? Very important. It seems like too simple, but really that's the big number one, okay? Number two is lifestyle factors, okay? Smoking, we got to get done. We're done with the smoking in 2025, okay, you guys? It's not helping you. It's not good for you. It's doing nothing but harming you, and it's increasing your wrinkles in your face. Besides the smoke itself, doing that repetitive motion of your mouth creates kind of fine wrinkles around your mouth, butthole, lips. Okay, we don't want that. We're not here for that. Other lifestyle things, limiting alcohol intake, and just in general having a healthy diet rich in fruits and vegetables and lean protein. You know, that's what we want. That's what we want. We're healthy, we're hydrated, we're eating all the yummy things that really become our medicine. We're eating food as our medicine, and we're eating the right stuff. And it'll help your skin. The Mayo Clinic talks about taking care of your skin, and you want to have an attitude of gratitude toward your skin. You want to support the skin, okay? Don't come at your skincare with an attitude of you're scared of aging, okay? It's really a blessing to grow old, you know? To grow older. You're more wise. You've seen a thing or two, you know? And your skin, it's blessed to age with you, okay? So we're going to support our skin as it grows. We're not mad at it. We're not frustrated at it. You know, come on. So in the morning, we can add a topical antioxidant like a vitamin C serum. Vitamin C is an antioxidant, so it helps fight the damage that UV rays try to bring, okay? Vitamin C has been shown to improve skin tone, skin brightness, and collagen production, and that's what we're looking for, you guys. And we're talking about like the serum on your face. Oral vitamin C is not recommended for anti-aging and anti-wrinkle benefits. You could take it for other reasons, but orally is not what we're talking about. We're talking about the dropper situation. So this would be in your order of operation. You do cleanser, vitamin C serum, moisturize, SPF. At nighttime, if you are so inclined, you could apply anti-aging products such as retinol or retinoid, which are forms of vitamin A. Retinoid is a prescription thing you'd have to talk to your doctor or your dermatologist about, or peptide cream. So with consistent use, the Mayo Clinic says, with consistent use, like 4 to 6 weeks, you can start to see reduction in fine lines, improved pigmentation, stimulated collagen production. At first, these products can cause your skin to be more dry, more red, and generally more sensitive, but your skin will begin to adapt after this 4 to 6 week period and looks to improve. It's important to use these at night because sunlight can decrease the beneficial properties of the retinol. So you don't want to wear it in the morning and go out in the sun because it'll decrease the performance of the product. Also, your skin can be more sensitive when using these, so you want to use it at night before you go to bed. So it would be cleanser, retinol, moisturize at nighttime. You don't need the SPF at nighttime because you're going to sleep, right? Sleeping indoors, Lord willing. We've talked about skin. Let's get on to the hair. My niece's friend was like, I've got dandruff. What do we do about that? Dandruff is very simply dry scalp, dry skin off of your head that breaks off and comes, showers down, rain, snows down onto your clothes. So it's more visible in dark hair and on dark clothing. It can cause your scalp to be itchy because all that stuff kind of flaking off makes your scalp itchy. It can develop for many reasons. Hair care habits. Are you washing your scalp? Are you washing your scalp correctly, like with your fingertips? If you just have naturally dry scalp, or oily skin can do the same thing, or other medical conditions can contribute. The treatment for it is pretty simple. You need to wash your hair regularly, and if you can add special formulations like things that include zinc, pyrithione, salicylic acid, which helps soften the scalp, sulfur, selenium sulfide, ketoconazole, or coal tar shampoo. Some of these things are more or are easier to find at the store. But you're going to apply the soap and lather it on your scalp and read the instructions because some of the things need to stay sitting on your scalp for like 5 to 10 minutes before you rinse it. So just read the bottle about how to use it. It can make your skin more sensitive to your scalp more sensitive to the sun, so you want to protect your scalp with a hat, or if you have thinning hair, you may want to apply SPF to your scalp. Most dandruff doesn't really require medical attention, but if it doesn't go away after you've been following these tips, for a good couple, 2 or 3 weeks, and you're still having the persistent dandruff, you should go, maybe talk with your doctor, because this could be a different kind of medical condition that you're dealing with. Apart from dandruff shampoo, we should be shampooing our hair anyway according to our hair type. If you've got fine, naturally straight hair with an oily scalp, you may need to wash more frequently, like maybe daily, if it comes to that. But if your hair is more on the coarse, curly side, you wash, maybe once or twice a week. You can wash it less frequently because your hair can absorb more of those natural body oils and things. So, and keep your ends trimmed as far as hair health. The hair is super keratinized cells, so you can't really make the hair quote unquote healthy. Scalp health is really where the game is. But as far as keeping your locks, like the long part of your hair, healthy, you just got to keep the ends trimmed. If you have split ends and stuff, you just trim that stuff off, So super keratinized cells, we'll move on to nails. Mine are not painted. They're nicely trimmed though. So my niece was like, okay, my nails get brittle and they split. And girl, me too. I have to keep mine short. And that's the recommendation, Brittle nails can be caused by either your nails getting too dry or them being wet too often, and then they split. So, sometimes you can hardly help it with washing your hands at work, and, washing hands is the number one way to prevent the spread of bacteria and illness and whatnot. So I do encourage washing your hands 100%. And so with all that hand washing, it can make your skin dry and your nails brittle. So it's just kind of part of it sometimes, but you can apply a thin coat of clear nail polish weekly to just reinforce the structure. Trim your nails regularly and then file with a fine nail file to help prevent splitting, because if you keep them short enough, they won't just split. And some people wear acrylic nails, and there's not anything quote unquote unhealthy or about that. You can have some problems with acrylic nails sometimes, with like a fungus getting underneath there, so you just need to inspect the nail bed between nail changes, like when you're at the nail salon, make sure they're taking the nails all the way off and you're checking those nail beds that they're healthy. Biotin is a supplement that has been touted for its benefits for hair, skin, and nails, but looking at the research, there's nothing really super conclusive, and there's no conclusive evidence that biotin does actually improve your hair and nail growth or health, but it can be helpful in some individuals. It's hard to overdose on biotin, which is vitamin B7, so it's okay to take a supplement if you feel like it's been helpful for you, but clinically speaking, there's no evidence that it actually helps, so you can make that decision. You're likely not deficient in B7 or biotin, and you'll get enough of it if you eat that well-balanced diet we talked about, and that should show in your hair, skin, and nails. So, my friends, that is all for today. I thank you for tuning in, and I pray blessings over you, and I'll see you next month. Okay, bye.